Since the release of seed usually coincides with orgasm for men, males who habitually experience delayed ejaculation often do not enjoy the sexual experience as much as they wish to. When diminished penis sensitivity makes release a problem, even when practicing appropriate penis care, a man may become frustrated and dissatisfied. The issue: men who have a hard time holding back ejaculation, especially those who are premature in this department, may not have much sympathy for their fellow men who find that they often engage in sexual activity for a considerable amount of time before achieving ejaculation. Yet it can indeed be a big problem. Imagine being a man who is valiantly continuing to thrust long after his partner has achieved satisfaction. The man is likely to become self-conscious and feel a different kind of performance anxiety, a pressure to unload immediately. This may in turn make it even more difficult for him to ejaculate. His willing and accommodating partner may become sore and tired from the continued activity. And sometimes these encounters end with the man losing his erection before achieving satisfaction. That can be quite frustrating for him, but it can also create problems in his relationship. His partner may come to believe that she must be doing something wrong, or that he doesn't find her sufficiently sensual if his delayed ejaculation becomes a non-ejaculation. Diminished sensitivity. There are numerous reasons why a man may experience delayed ejaculation. Sometimes it may be psychological in nature. At other times, it may be a positional issues, meaning that his penis is such that it needs a specific positioning during the sexual act to receive the friction that it requires. Often, however, delayed ejaculation is a result of diminished penis sensitivity. Everything is functioning just fine, mentally and physically, but the penis itself has become somewhat deadened, and just doesn't have the same degree of sensitivity that it used to have. Why? Well, sometimes the reason is that the penis has suffered some kind of trauma. This can be a sudden and very noticeable trauma, as when the erect penis slams into an object unexpectedly or at an unexpected angle, causing a blunt force injury, accompanied by pain and slash or bruising. This may also result in the creation of a thin layer of scar tissue, which can lessen the organ's ability to experience sensation fully. In such instances, the trauma is quite noticeable. In many other cases, however, the trauma may be much subtler and may go by unnoticed. In these instances, the trauma is caused by rough handling, usually during sexual activity, but it may not be so rough as to be noticeable. For example, a man may masturbate frequently while using a grip that is far too tight. The friction causes damage, but the sensual pleasure he is deriving causes him to ignore the friction-related discomfort. Similarly, a man may enjoy partner sex without sufficient lubrication. The friction again may not be noticed due to the enjoyment of the activity. These more subtle forms of trauma can cause peripheral nerve damage. Over time, they can contribute to a significant decrease in penis sensitivity. The result may be the delayed ejaculation issue under discussion. Care. One excellent way to work on the issue of delayed ejaculation caused by decreased penis sensitivity is to regularly apply a top drawer penis health cream. Health professionals recommend Man 1 Man oil that contains acetyl L-carnitine. This neuroprotective ingredient is excellent at helping to restore penis sensitivity to manhood that has experienced the traumas mentioned above. If the CRME also contains vitamin C, so much the better. Vitamin C is well known for its advanced role in collagen production and penile tissue firmness. These two components are essential for men who are working through penis sensitivity issues or who simply want to better maintain the health of this most important of organs.